Good afternoon, everyone, and thanks for joining us on the program Stewardship with SNB from the studios of RSTV here in Portugal. Today, we'll be joined by no other person than the Executive Secretary of the River State Healthcare Management Board, Professor Kinikanwo Green. Professor Green, you're welcome to our program.
Thank you very much, Mr. Wade.
Okay, primary health care is the first port of call when faced with health challenges. In fact, it's family health. And of course, it's all about community health, so to speak. So, what would you say is the policy thrust of the former-led administration towards this primary health care matter?
All right, thank you very much. And viewers at home, we want to thank you for this very wonderful opportunity of having me in this very important program. Of course, we know that His Excellency Sir Simeon Fubara, the Executive Governor of Rivers State, is doing very well, especially in the health sector, and of course, especially in the primary health care system in Rivers State. And his policy trust has remained to ensure that he delivers the highest level of primary health care that is attainable in Rivers State, to ensure that this all-important aspect, this all-important segment of healthcare delivery system is optimized in Rivers State. Of course, as you just stated here, primary health is like the entry point into the healthcare delivery system that should, according to the World Health Organization, take care of about 70 to 80% of our health needs. And of course, His Excellency is poised to ensuring that this is achieved. And of course, with the Deputy Governor by his side, who has also, ensured that we carry on these programs very well. And our own Amiable Commissioner of Health, Dr. Adeze Ore, who is a goal-focused and result-oriented commissioner. We are just, of course, blazing the trail and ensuring that primary health care gets to the next level.
So, what else are the primary health care centers equipped to handle?
Well, of course, just as we stated earlier, primary health centers are the first port of call, and apart from we have the basic primary health care activities that we handle in the various PHCs. Currently, we have about 344 primary health centers that are scattered around the nooks and crannies of River State, and in terms of what are the health challenges that we handle, we look at immunization services, because prevention is very key in terms of primary health care. So we have immunization services, and we have what we call the routine immunization services, where we give vaccines against the vaccine preventable diseases. And of course, this is important because you prevent things like polio, tuberculosis, and other vaccine preventable diseases. And of course, this is key in terms of primary health care. So apart from immunization, we do other routine services like maternal and child health care. For the maternal health, we take care of antenatal care. We take care of other complications of pregnancy, and of course, delivery is very important, and we do that in primary health care. Of course, delivery of patients that are uncomplicated, because for higher risk pregnancies, we refer them to secondary or tertiary level of care. And of course, apart from maternal health, we also take care of other things like prevention of cervical cancer. By next month, we are going to, that's in May, Rivers State is among the second batch states that will introduce what we call the human papilloma virus vaccine. And this is geared towards prevention of cervical cancer. That is, one of the highest causes of mortality in terms of malignancies of the reproductive tract. So apart from the maternal care or care of women, we also take care of the children. Of course, I've mentioned the importance of immunization. Other important diseases that a child can present with malaria, upper respiratory tract infections, urinary tract infections, and all that. These are all taken care of in our health centers. And of course, we know that how the economy is, and it's important to plan our families. So family planning is one of the key things that we do in the health centers, and we also encourage our families, our women, our men, that we should seize this opportunity, because the staff in the various health facilities are well trained to carry out this facility. Just before I just allow you to go, I need to state here that adolescent health is very important, and we take care of adolescent health in the various primary health centers.
Yeah, I was going to ask you, when you talk about your primary health care workers are very well equipped and trained, I was going to ask you what measures you have to evaluate these health workers at the health centers.
Yeah. So, well, let me thank you for this very important question. We know that primary health centers are community-based, because we also encourage community ownership of the PHCs, so that you don't think that the PHCs are just only for mothers and their children. Now, we have what we call the ward development committees, and these ward development committees are, attached to all health facilities, where the community takes ownership of the health facility, and of course they evaluate they evaluate the functions and functionalities of the various health facilities. So we have the ward development committees. We also have the facility management committees, where meetings are held on a monthly basis to review what the health facilities are doing, what are the challenges that they have, what are the solutions to these challenges, and how do they escalate these challenges up to the LGA level, to the state level, so that solutions can be profiled and also handled. And of course, apart from the facility management committees, at the LGA level, we have what we call the local government health authority. Of course, we have the supervisor for health heading that, and then of course the medical officer of health in each LGA is the secretary of this local government health authority. They also have their monthly review meetings, and they evaluate the functionalities of the various health facilities. And of course, beyond the LGA, they also escalate it to the state. At the state level, we also hold our monthly review meetings with the medical officers of health, program officers, to evaluate what they are doing, and where they are not doing very well, corrective measures are brought into the limelight to ensure that solutions are profiled to whatever challenges that we have.
Prof, you're aware that primary health care is community-based, and a patient wakes up late night to stroll across the road to have himself taken care of by maybe a health center around there, and it is short. Why is the primary health care not providing 24-hour service?
Okay, thank you for this question, because this is also an avenue to send out the correct information to our viewers.
Yes.
Now, we have what we call the types: 1 facility, type 2, and type 3. For type 1, where we do what we call basically immunization services that run between 8 a.m. to 2 p.m. For types 2, we take delivery. Types 2 and 3, deliveries are taken. And of course, we expect that everybody, for each of these facilities, we have resident nurses in the health facilities. And of course, in some of the facilities that are type 3, we also have resident doctors that are on ground in these facilities. And of course, 24-hour services are carried out in these facilities. We may have challenges here and there, but of course, that doesn't mean that these facilities don't run 24 hours. If we have, of course, as an obstetrician, I know that most of the deliveries, most labor cases happen in the night, and it's important to ensure that these services function optimally, even in the wee hours of the morning, late night, and all that. So our facilities have this capacity to take care of health needs, even at 12 midnight, 1 a.m., and beyond.
Yeah, even as we record deaths, more births too are being recorded, meaning that more children are born. And how many health centers do you have in Rivers State to take care of the ever-rising population around the communities and elsewhere?
Yeah. Okay, thank you. Well, in Rivers State right now, we have, on the whole, we have about 344 health facilities.
Existing ones?
Existing. However, some of them are types 1 facilities. As I said earlier, type 1 health facilities don't take care of deliveries. For type 2 and 3, these ones are the ones that take care of deliveries. And we have about 220. So you can see that in Rivers State, we have 319 wards in Rivers State, and there is still need for us to get more facilities in some of the wards that don't have, especially types 2 and types 3 facilities. And of course, we know that His Excellency, who is also a health-friendly governor, has interfaced with us severally, and he has given us that, that positive inkling that whatever challenges that we have, that we will be set, we'll be ready to ensure that he deals with them. Already he is doing that. Of course, coming on board, we found out that some of the facilities have been, because these facilities have been there for over 12 years.
They're obsolete.
Yeah, so within this period, we have revitalized a lot of the facilities in most of the LGAs. Even as we celebrate his 1 year in office, over 50 facilities have been marked for revitalization and commissioning within this period. And we know that, we are renovating the old ones that are, that are decrepit. Newer ones too will also come. And of course, we also know that human resources for health is something that is very important. I need to just quickly say that His Excellency, not just approving, he has done promotion for the over 4,000 local government area staff that we have.
Prof, we'll come to all of that. You said you have over 300 health facilities.
Yeah.
Do you have plans to build new ones? Considering the fact that the Oceania communities like Soku and Mile and elsewhere, have always had problems of cholera because of poor water and all that. Yeah. Do you have plans to build more?
Yeah.
Especially in the riverine, the Oceania community?
Such plans are in the pipeline, and of course, just as you said, we have hard to reach areas like Suku and all that, the Oceania communities. And even in some areas that have large land masses, you still find out that there are some areas that it's still difficult to get to. So of course, for such areas, the management of the board, still plans to interface with His Excellency, and we know that hopefully those facilities will be built, especially for those areas that need it. Remember, I said that types 2 and types 3 facility, we have about 220. So that means there is need for us to do more for areas that don't have those facilities that have the capacity to do delivery, especially at midnight and all that.
So what is the focus of the administration? Is it preventive or curative? And why?
Yeah, primary health care is something that is community-based, and of course it's a form of care that that should be people-centered, that should be affordable, that should be accessible to the community. And if you note all these important facts, you see that prevention is, as we say, is better than cure. So we ensure that we carry out a lot of preventive practices. Immunization is a strong pillar in primary health care. Hence, it's a preventive strategy to ensure that we prevent against childhood illnesses and diseases. So prevention is very key in this administration, and we're ensuring that immunization practices are robust. Of course, we carry on a lot of health awareness. We go to the various, we have our state health educator, and of course, the various...
Yeah, I was coming to that, Prof, because most of the diseases in rural areas, but mostly malaria, most of them are in the rural areas are infectious. And then we want to know if your administration has put anything on ground for enlightenment of the people.
Yeah, definitely. Definitely, we are doing that, and it's a work in progress. We have ensured that the state health educator,
by way of radio and TV jingles and all of that.
Yeah, we interface with media. We have what we call the media advocates for health, where we even interface not just with the media, with the religious leaders, with the traditional leaders in the various communities, because these will now act as mentors to the various persons in the various rural and both urban communities. The chairman of River State Traditional Council of Chiefs, in the person of Eze Sergeant Awuse, is collaborating with us very well, and he has also trickled down amongst his own council of chiefs in the various senatorial districts, in the various local government areas. The various traditional rulers in River State have been, have already been told, they have already been admonished to ensure that primary health care programs that are done in their various domains, they are the leading lights of these programs. And of course, we are really happy with the efforts that the traditional rulers are putting in place. The religious leaders, both the Christians, the Muslims community, we are working with them, and of course, we are interfacing with them very well. We do a lot of campaigns in various churches, various mosques, and all that, telling our people the importance of primary healthcare services, not just immunization. Of course, for immunization, we have routine immunization days, what we call the National Immunization Plus Days, where we go to the various nooks and crannies of the state, various houses, to knock at the doors of our people to bring out their various, their children that are due for this immunization. And we go to churches and all that, enlightening them on the importance. And of course, let me also seize this opportunity again to tell our people about the human papilloma virus vaccine initiation that is coming up next month.
Okay.
We are already, we've done the national training of trainers in Abuja, and of course in the state here, we have already kickstarted the state training of trainers. And as I talk to you now, various training sessions are ongoing to ensure that we interface with the Ministry of Education, we interface with the various private schools, government schools, paramilitary and military schools, to tell them the importance of this vaccination for, and in the future they will prevent cervical cancer. As I said, it's one of the leading causes of death, especially in terms of reproductive tract malignancies. Cervical cancer, as I said, is one of the leading causes of deaths, especially in terms of reproductive tract malignancies.
Professor, water is the major source of infection. You will agree with me. What's your relationship with the Ministry of Water Resources and, of course, Community Development Authorities?
Yeah. Well, that's very important. We have a very robust relationship with what we call the RUWASA, that is the River State Water and Sanitation Agency.
Okay.
The Director General interfaces with us here. Once in a while, when we do our review meetings, we invite them for lectures and all that. And of course, beyond that, we also have the environmental health department here, and we have environmental health officers that go around and supervise the sanitary conditions of not just the facilities of the rural populace. And of course, so we have that interface with them, and of course, it's yielding good results.
Prof, would it be correct to say that due to lack of medical personnel, you don't monitor the doctors you post to the rural areas? Would it be correct to say so?
That's definitely not correct.
So what is correct?
The correct thing is that, we know about what we call the Japa syndrome. But if you recall, even when the Honorable Commissioner was making a press statement the other day, she made it very clear that even in terms of the employment that His Excellency has graciously approved in River State University Teaching Hospital, we have people from the diaspora that are even applying for positions positions in terms of medical personnel and all that. So, in terms of supervision, we carry out supervisions at various levels, at the LGA levels, at the state levels. We, as I said earlier, we have the local government health authority that is headed by the supervisory councillor for health, and of course the medical officer of health is the secretary of that council. They do what we call supervision amongst the various health facilities in their various LGAs, and they now report to us. From the board here, we also now do what we call integrated supportive supervision. In this, we ensure we go to the various facilities, we go to the rural areas, we go to the hard-to-reach areas and all that, and find out how our staff are also doing. We know that in terms of motivation, before now there was poor motivation by our staff. You go to some facilities, some people will not, will tell you, oh, they've not been promoted and all that. But of course, having done the promotion, you see that that has really gingered, that has really motivated the staff of the board to ensure that they have the highest and attainable level of commitment in terms of healthcare delivery in their various places of work. So in terms of supervision, that is effectively being handled by the management board.
Prof, you have talked to the 99 dozen, telling us about the success story of the primary healthcare system. What challenges are confronting you?
Well, let me thank you very much for that. I mean, if we say we don't have challenges, that will not be correct. Just like in any human existence, there are challenges. But your ability to tackle and confront and sort out those challenges will be very important. Well, we human resource for health. We know that we need employment of staff. Of course, you are aware that His Excellency has already approved, and they are already carrying out employment of 500 health staff in River State University Teaching Hospital, and also 500 for the Hospital Management Board. We know that for primary health care, as will come very soon, we've already gotten the assurances of His Excellency that will be done. So that will be a challenge, but which is already being sorted out. And then, of course, there's what we call the transfer of LGA workers to the state.
I was going to ask you if there are demands by health workers. And are you able to meet up with them?
That's a major demand that the health care workers should be transferred to the board. Their salaries to be transferred to the board. Of course, there's already a law that was promulgated since 2010, and His Excellency has already given us the nod that he will interface with the local government chairman, and of course the Algon chairman statutorily is a member of this board.
Okay.
So we are already, the discussions have reached a high level, and we know that for the commitments we are getting, that this will soon be done. So if we get there, I think we'll be really ready to hit the to continue flying.
Primary healthcare, of course, we have said here that it's a community-based thing. What's the role of the community when it comes to primary healthcare?
Community is like the heartbeat of primary healthcare. Without the community participation, there's no primary healthcare, and that is why, as a board, I said earlier that we have what we call the Ward Development Committee. That means the members of the ward, the CDC chairman of the ward or the community, the woman leader, the religious leaders in the communities, they are all parts and parcel of the Ward Development Committee. They meet regularly, and once they meet and review activities in the primary health centers, when they notice activities that are not right, they of course escalate it to the facility management, to the local government management, and of course to the state level. And we encourage them to meet regularly, monthly meetings, to ensure that these, they act as a check. Of course, we have checks and balances. They check the staff that are working, because they own this facility, and it's important that they ensure that these facilities that they own work optimally, and then where there are complaints, they escalate it to the LGA escalates it to the state, and of course we now ensure that whatever challenges that they are sorted out.
On a final note, Prof, what would be your advice to primary healthcare workers across 23 local government areas?
Okay, thank you very much. I think from this end, the advice is you have promotion interviews have been done. From the government angle, the commitment has already, they've shown that tenacity to ensure that they improve the motivation and the welfare of our workers. So, to whom much is given, much is also expected. So, just to let our people know that having achieved this feat, we expect them to show seriousness. We don't expect that when we get to the various facilities, we will not see them at their duty posts. Of course, punitive measures will be carried out, and whatever negative vices that we notice, we are also going to ensure that we nip it off in the bud, and that we continue to give the highest attainable level of primary health care in line with the vision of His Excellency Sasimolaye Fubara, the GSSRS, the Executive Governor of Rivers State, and his team.
1 year down the line, on a scale of 10, how would you rate the governor in terms of provision of health facilities?
Wow. Well, of course, these are specifics. He has done very well. That's
on a scale of 10.
On a scale of 10, I will rate 8.5.
Oh, really? Why?
Yeah, because you can see that, funds come regularly to the board. And of course, healthcare financing is something that is very important. And he has also shown that capacity, because I'm sure you are aware that currently Rivers State is the zonal champion in terms of primary health care.
Okay.
In a competition that was done by Nigerian Governors Forum, Bill and Melinda Gates Foundation, and Aliko Dangote Foundation. We came first among the states in primary health care.
Oh, that's good to know.
Yeah. And of course, we got a reward. We got rewarded for that with a price tag of $500,000.
Oh.
And of course, these monies have been earmarked for various states according to the work plan. So you can see that on the 29th of December last year, His Excellency was at Model Primary Health Care Center in Apajo. He was there physically, and he went there to see what was happening in the primary health care, because one of the requirements is that there should be a quarterly visit by the governor of the state. He has already done that. For the first quarter of this year, the deputy governor, Professor Ngozi Maodo, was in Model Primary Health Center in Rumibo, and that will give us some points for the first quarter. As I speak to you now, for the second quarter, His Excellency is billed to attend go to Model Primary Health Center.
Visit
Model Primary Health Center in Indoni. That will be coming up on Thursday.
Okay.
So you can see his, grassroots participation is very important, and they require that the person at the helm of affairs should go to the grassroots to feel the pulse of the people at the grassroots, to ensure that they get it, firsthand what is happening. So I think, by and large, he has done very well.
So what aspect of the primary health care do you want the governor to also look at?
Yeah,
because he scored it 8.1 or so.
Yeah. So about it. So, there are some wards that still lack primary health centers. So this will also be an avenue to appeal for some of those areas that don't have modern primary health centers. Our appeal will be that new primary health centers should be built for those people. And then, of course, we also talk about human resources for health in terms of employment and all that. We'll also use this medium and we know that he has given a nod, but of course to facilitate the bureaucracies and all that about the employment of PAC workers, and ensuring that we have adequate human resources for health at the various primary health centers.
All right, Professor Kinikanwo Green, Executive Secretary, Rivers State Primary Healthcare Management Board. Thank you so much for your time. Thank you.
You're welcome.
My name is Solomon Nelson Braid. You'll join us again same time when this program will come to your living room. For now, it's bye-bye.